Purple Giant,
Sizzurp,
Dirty Sprite. These are all street names for one of the most dangerous drinks floating around at parties. Lean. It's a codeine concoction that's often mentioned in pop culture, but its risks are actually pretty serious.
Yeah, lean's been making headlines, and there's a lot of misinformation out there.
There definitely is, Clint, and that's why we're digging into one of our most popular Sandstone Care articles on the subject. Lean. 15 shocking purple drink facts.
Right, Deb. And the article really focuses on how lean affects young people, teens, and young adults especially.
Which honestly makes you wonder, what is it about this stuff? Like, why is it such a big deal, especially for the younger people?
Yeah, we need to unpack that. But first, just so everyone's on the same page, what exactly is lean?
Okay, so lean. At its core, it's a mix of two prescription meds, codeine and promethazine.
Okay, codeine, that's a painkiller. Most people know that. But what is promethazine?
So not as familiar. It's an antihistamine, so like allergy med stuff to stop nausea. But when you combine them, and this is key here, the combo, that's what makes it dangerous. And then they mix it with soda and candy and whatever else they could find, and that's lean.
So it's like they're making serious drugs seem like, I don't know, a sugary drink.
Exactly, and that's what's scary, especially for young people. You don't think about it being dangerous when it's disguised with all that, like with candy.
No kidding, but what is it about this codeine and promethazine? What makes you feel high?
Okay, and that's where it gets interesting. And so this article explains it pretty well, I think. It all comes down to your brain, specifically dopamine. Everyone's heard of it, right? The feel-good chemical, but it's a little more complex than that.
Right, dopamine's what makes you crave things, the things that are good for you or what your brain thinks are good for you. So how does lean mess with that whole system?
Okay, so the codeine in lean, that is actually an opioid. And opioids, they kind of hijack that reward system. So suddenly your brain's flooded with a bunch of dopamine, way more than usual, and it's not even from something naturally rewarding.
Right, so that's that euphoric feeling that people talk about.
Exactly, the relaxation feeling. But here's the catch, and this is what the article really drives home. Your brain, it's always trying to find balance. So when you keep hitting it with these huge dopamine spikes from lean, it starts to compensate, like way too much, okay? It's got to adjust.
And so it starts producing less dopamine naturally.
Right, and it becomes less sensitive to it overall. So then you need more lean to just feel normal again, let alone to get that initial high that you had.
You're chasing a feeling that's now basically impossible to reach at this point. And meanwhile, your brain's basically hooked. That's a recipe for addiction, right?
Yep, and it's not just the addiction that's a problem, right? It's the side effects too. And so this article gets into some details about that. And some of it's pretty scary, actually. I mean, we know about the drowsiness, the slow thinking, but they mention liver damage too. That's not what comes to mind when you think of a sugary drink.
No, it's easy to forget. We're talking about serious drugs here, each with their own risks. You've got the opioid side with the codeine, and so that's respiratory problems, constipation, even overdose if someone takes too much.
Right.
And then the promethazine on top of that, now you're talking dizziness, confusion, blurred vision. Your mouth, it gets all dry.
It's a lot. And then people mix it with other stuff like let me just add some alcohol to this already dangerous concoction. Or more cough syrup, like that's gonna help.
And that's when things get really dangerous really fast. One thing that stuck out to me in the article was they mentioned lean popping up in EDM and hip hop scenes.
It makes you wonder about that connection, right? About how music scenes or just culture in general shapes our views on this kind of stuff.
Absolutely. But for now, let's shift gears a bit. Let's talk about recognizing the signs if someone might be struggling with lean.
Yeah, because that's the important part, right? Knowing what to actually look out for.
Exactly. Catching it early, it makes a huge difference. And the article does a good job of laying out some, what we're going to say is red flags, like behavior-wise. A big one is withdrawing from things that they used to love. So think about hobbies, friends. If someone's suddenly isolated, that's a sign.
Yeah, like their priorities get all messed up.
Right. And then Physically, sleep's a huge giveaway. Sleeping way too much or you can't sleep at all. That's common with substances in general. Appetite too. Either that vanishes or they're chugging sugary drinks all the time, trying to cover the taste. And of course, any withdrawal, that's serious. So we're talking nausea, sweating, shaking. Let's call a doctor territory right away.
For sure, and this is really heavy stuff. But the good news is that they've talked about the treatment in this too, right? At Sandstone Care, we understand that everyone is different. There's no one solution works all for everyone.
Yeah, we're big on individualized care. Some people need inpatient setting, structured, supportive to really dig in. Others, outpatient works, where they can keep their life going, but they have therapy groups, all of that.
So it's really about finding that right fit. So whatever works for each person, whatever works for you.
Absolutely. And remembering that addiction doesn't care about who you are. Age, background, none of that matters. Asking for help is the strong move. Never be ashamed to reach out.
That is so true. And this has been a lot. What would you say are some of the key things you want people to take away from all this?
Awareness for sure. The more we know about lean, the risks, what it actually does, the better choices we can all make. And if someone is listening and they're worried about themselves or someone they love, there's hope. Places like Sandstone Care are here to help. Don't wait to reach out.
So well said. And as we wrap up, I just want to say to everyone listening, thank you for exploring this topic with us. If you want to learn more, definitely check out our blog articles on the Sandstone Care Treatment Resources page. So stay curious out there, and we'll catch you next time.